This meeting is being recorded.
Yeah, please go ahead.
Recording starting అనగానే అందరు మాటలు మానేశారండి.
Yeah, so good morning all. So thank you for joining. I will quickly go the agenda of the day and then I think we'll take it from there. So initially I will introduce the TANA leadership and then we'll introduce the guest speaker of the day, Dr. Manjula Garg, and then the main presentation session on COVID-19 OMICRON takes place, followed by Q&A session. So that's the agenda. So with that, I would like to welcome our TANA President Anjay Chaudhary Garu to give the welcome address to the gathering and talk about the event.
Thank you, Ram. Can you hear me, Ram?
Yeah, clear.
Yeah, thank you.
ఎక్కడో బ్యాక్గ్రౌండ్ ఎక్కువ వస్తుందండి, ఎవరిదో రెండు ఆన్ చేసినట్టున్నారు.
Yeah, probably the others probably can mute and you can.
Yeah, ఇప్పుడు లేదు.
Okay, all right. Yeah. Good morning, everybody. Thank you, Ram, for the kind welcome. So just I know today is Saturday, and of course everybody are dozing and lazing around in their beds or probably at their house. But definitely, I want to recognize the participants first. So that shows the enthusiasm of being on top of the current situation and having the aptitude to learn what the current situation is about Omicron without taking things granted. So first, I would once again want to thank, of course, from bottom of my heart, Manjula Garg for coming forward for this noble deed, and on behalf of TANA, not only on behalf of me. So welcome her and heartfelt thanks. And of course, for any program, in addition to the participants, we need the organizers. Without their unconditional support and work, nothing is possible. So want to once again recognize our community service coordinator, Raja Kaskutti, and of course, Ram Tota, he's from Bay Area, and the entire leadership. And within the leadership, I still want to recognize, because they're spending their invaluable time to support the program and to take their share of knowledge as well. So I want to recognize our immediate past president, Sri Jaita Garu, and also our women's coordinator. I'm sorry, I could see Satish Vemuri, our secretary. Satish, can you say hi?
Hi, Nick.
Thank you. Okay, I know you're turning the other side, so just want to get your attention. So
then, I am actually.
Yeah, you're good. And then I could see our women's coordinator, Garu, and of course I see Venkat Misala, our Southeast RR, and and every others. Didn't want to miss anybody, whoever are from the leadership. Thank you once again, and my special thanks to the entire leadership for their unconditional support in promoting and encouraging these activities. And before diving into the agenda, I just want to submit a couple of observations. So I see that people are taking Omicron as granted, just that it is not as threatening as previous variants. It's not good for the community. And I also, overheard, and we also see people thinking that, okay, anyway, it is not life-threatening. Anyway, we have our booster doses done. Let it come and go. But I strongly advocate that shouldn't be the attitude, because once you get, COVID, it has its own share of, negative effects. So that is the reason why we shouldn't have that attitude. That's number one. And also, when I was looking at the flyer and the agenda items, definitely, I think it has a wide variety of covering all the aspects of what is Omicron, how, severe it is in threat-wise, how it is different when compared to the previous variants, and how we can eliminate, future variants, and also how we need to take care of ourselves and families. That was a nutshell. That was the agenda. So I think the Manjula Garg will cover in detail, but please do listen carefully and take back what is needed and protect our families And then please pass the word to your friends as well. And as Ram mentioned, we would have the recording. So once we are done with the program, we would definitely pass on the recording, and all. I humbly request all of you to pass on to your friends as well, because this is invaluable. So don't take OMICRON as granted. So having said that, didn't want to take much of your time. Once again, thank you everybody, and let's dive into the session. And back to you, Ram. Thank you all. You all have a good day.
Thank you, Anjay Garu. I also would like to quickly request our past president, J. Taluri Garu, if you have a word for the audience.
Andariki namaskaram andi. Once again, first of all, I want to thank Dr. Manjula Garu for coming forward to give this seminar, and also the organizers and entire TANA team and everyone here. I don't want to take too much of time. It sounded very interesting to me. That's one of the reasons I joined, because there's a lot of things that she's going to say, explain today. Once again, I thank everyone for attending this and also organizing this, and the organizers. Thank you, Anjay Garu. Thank you for taking forward this. Thank you.
Thank you, Jay Garu, for joining us and supporting all the time. And I think I would also request Satish Garu, if you are there, can you say a word?
Just I want to thank you, Manjula Garg, Ram, and Raja Kaskurti for doing wonderful. And I want to thank entire leadership who's supporting all these things. Thank you again, Manjula Garu. Thanks for joining all participants. Thank you.
Thank you, Satish Garu. Satish Garu is our secretary of TANA. So now, along with me, we have Raja Kaskurti Garu, the community service coordinator, who is also part of the organizing team. And I would like to request him to say a few words, and then we can introduce the guest of the day and then dive into the main session. Raja Garu.
Yeah, thank you, Ram. Thanks to all the TANA leadership, Anjay Garu, Jay Garu, Satish Garu, Uma Garu, everybody who joined, Venkat Misala, and whoever is there. Thank you all for joining. And also, this is a very important session for the community. So even though the Omicron started late December and it was in peak first week of January, there is a lot to know. And this is not only on the Omicron, how we are going to take care of ourselves going forward. Manjula Garu is going to explain all those details. Thank you, Manjula Garu, once again. And thanks, Ram. Please go ahead.
Yeah, thank you, Raja Garu. Yeah, so before I introduce our guest speaker of the day, Manjula Garu, we all know, incidentally, yesterday, January 21st, 2022, is marking 2 years since the very first COVID case is confirmed in the United States. That happened in Washington State. So we are already officially into third year of COVID and Omicron. So we were always TANA is always trying to help the community whenever there is a need, starting from providing oxygen concentrators and supplies, and even most recently we were providing home-based test kits and all that. So part of that, we wanted to educate all the members of TANA and Telugu community in Northern America what information they need to know about this Omicron variant, which is contagious, most contagious and fast spreading one. So Dr. Manjula Garg is the right expert, we thought, and then we requested her, and she's readily accepted to provide information to our community. So I would like to thank her, and I will quickly go over a quick introduction of Dr. Manjula Garu. Manjula Garu is an MD, FAAFP, ABARM, and Dr. Manjula Garu is a family physician and an anti-aging and integrative medicine physician who has been practicing medicine for 25 years in the United States. She did her MBBS from Guntur Medical College in India and went on to get her post-graduation in OBG at Osmania Medical College, Hyderabad, India. She did her residency at St. Vincent's Medical Center in New York. She remained abreast of trends and developments in her field as a member of the American Academy of Family Physicians, the American Medical Association, American Physicians of Indian Origin, the Texas Academy of Family Physicians, and the American Anti-Aging Academy. She has received several awards and accolades over the course of an illustrative career, such as Distinguished Humanitarian Award, Top Female Executive Award, Elite American Physician Award, Professional of the Year Award, Continental Who is Who Pinnacle Award, and so she currently practices medicine in Sugar Land, Houston area at 2 locations through a medical facility named Medwin Family Medicine and Rehab. She also enjoys badminton and chess and reading. So with that quick introduction, on behalf of TANA, I would like to formally welcome you, Dr. Manjula Garg, to the event, and we are privileged to have you today.
Thank you, Ram Garu, and thank you all the board and all the volunteers and the participants for being part of this. So more of what is needed currently is education of the people to really understand how the COVID is changing and how is it affecting the people, the functions that we do, the work we do, and how it is transitioned from people staying at home indoors over the last 2 years, and how are we planning to see it change over the next few months or so. So right now, statistically, we are seeing in India, yes, in US yesterday, we had about 700,000 cases. India reported 3 lakh cases in one day. And the Omicron variant, the infectivity rate is almost 40 to 45%. So if there's somebody exposed and you almost have a 50% chance of getting it. And it is much less severe than the initial variants. But again, people are still getting sick. And the people ending up in the hospitals is about 2 to 5%. And how many people are ending up in the ICU is about 1 to 2%. Does that mean that people who are getting the Omicron are better than what it was in the initial wave? Possibly, yes. So the severity of the disease now is a lot lesser than what it was before. And the more severe cases supposedly seems to be in the people who are unvaccinated. And whether it's the Moderna, the Pfizer, the J&J, whichever vaccine you have taken, the CDC is still recommending at least 2 doses, or possibly a 3rd booster and a 4th booster. So we don't know how long this will continue and how many boosters we will need. It's possibly going to end up like the flu virus. The strains are evolving, it is changing, the virus is evolving every day. So I think so far what we are seeing, the severity of the initial variants to the Omicron variant seems to be going down a little bit, but the infectivity rate is about the same or has been a little bit more, because the Omicron seemed to be, they identified in South Africa, but then at that time they already identified it. Other countries, people already had diagnosed the same variant because the genetic makeup has changed of the virus. And it is constantly changing and evolving. There's another new variant they're going to disclose in the next week or so because there's a new variant. And then right now, the policy for the masking and all that, and we do have a, currently the CDC has said, if you get the Omicron or the COVID right now, you have to quarantine yourself for 5 days. And after that, you can wear a mask and go around. No retesting is recommended at this point. So people are panicking. What is the reason why people are panicking? Oh, I got the Omicron. I want to make sure I'm negative before I go out. So whether you like it or not, let me tell you the stats. Even if you get the vaccine, you're possibly still shredding the virus and can still spread COVID. And it's similar if you get the COVID disease itself, you're shredding the virus and you can spread it to other people. And the most infective time is between the day 1 to day 3 after you get the infection. So after day 5, the amount of virus that you're shredding is lesser. So does that mean after day 5, you're completely free and you can go around doing everything and spreading the infection? We do not want to have that situation. Though after 5 days, the CDC says you can go around doing your stuff, you're still recommended to use a mask and a PPE protection so you don't spread the virus to other people. And other things like for the kids and the family of somebody is exposed, somebody in one person in the family had the COVID, what do we do with the rest of the family members? Do we quarantine them? Yes, you do quarantine for the first 5 days. And after 5 days, if anybody else has the symptoms or so, they can get retested. And the initial person who had the vaccine, there's absolutely no reason to test to have a negative test at this time, because a lot of people are like, do I still have the virus? Yeah, we are still seeing people positive after 2, 3, 4 weeks. Does that mean they're still infective? Possibly yes, because they still have the virus. They can still be spreading the virus to other people. At that time, what do we do? I mean, do they have to confine themselves to the home environment and stay at home, quarantine and isolation? I don't think that is recommended by the CDC right now. Again, after 5 days, CDC says you can go around wearing a mask and a PPE precautions to other close contacts. And regarding the kids and the vaccines, I think right now after 5 years, they have recommended the vaccines. Pfizer and Moderna also has been recommended for kids over 12. So definitely recommend to get the vaccine, but is that 100% protective? No, but what we are seeing is the severity of the disease for people who are vaccinated is a lot less than the severity of unvaccinated people. And yesterday, there was a recent study released. It's a little controversial, but I'm going to tell you. Because the study was, does the COVID PCR detect flu and the COVID? Why do we see a lesser amount of flu tests in the last 2 years? The fact was that the PCR was not sensitive only to the COVID. It was also, there was a false testing of the flu test being reported as a COVID on that. So whether we had the COVID or we had the flu, technically you couldn't say if you had the PCR, but you presume it was COVID till you did not have a test for the flu. Does that mean there's any change in the management, whether it's the COVID or the flu? Possibly yes. If I know you have the flu, the treatment would be different. And if it's a COVID, the treatment would be different. And recent trends in the treatment, now we also, initially there was a lot of overusage of the steroids, but now the current recommendations is unless the patient is really sick, you don't want to be overloaded with the steroids because there are negative effects of using too much of the steroids. So that is something I would like the people to be aware of. So if somebody says, oh, you have to be on 30, 40 milligrams of Decadron or something, unless you're being seen and being closely monitored with the lung symptoms or something. And I don't think that is recommended at this point. So again, you have to consult a physician to get the right treatment if you get diagnosed. And most of the cases right now are slightly milder than how they were in the initial wave. And currently, how do you differentiate a common cold or a flu from the COVID is the next question. Common cold, you would still have a running nose, body aches a little bit, and more of a stuffiness and a headache. And the flu would be more body ache, generalized weakness. And the COVID, you would have all those symptoms, plus a loss of taste and the smell, and also a lot of people having difficulty swallowing and severe throat pain. That has been one of the most common symptoms of the COVID. So definitely, if you have any of these symptoms, definitely recommend to get either a PCR or a antigen test. And then now, hopefully, we will be getting or availability of the home test kits. So if somebody is positive, yeah, they can consult their physician, stay quarantined for the initial 5 days till the symptoms resolve. And if the symptoms are not resolved, they definitely need to seek a medical opinion. Now, what are the other ways people can do to try to get or not stay away from the COVID? One myth I really want to clear for the people. In a pandemic, more than 95% of the people will get the disease. So whether you get it now, you got it 2 years ago, can you get it again? Or will you get it again? Yes, possibly you'll get it again, because I'm seeing people who had it 3-4 times even after getting the vaccine. And should we be concerned about it? There are people who did not get very severe disease in the first wave, got a severe disease in the second wave with the new OMICRON variant. And same thing, people who got a disease in the first wave, it was much lesser in the OMICRON, the severity. They just had more like a common cold. So how can we know who is going to be affected and who will be milder disease, who is severe disease? At this point, there's not a whole lot of predictability on that, but what we know is people with other conditions like diabetes, morbid obesity, sleep apnea, smokers, COPD people, these are the people, or if they're immunocompromised like chemotherapy, cancer patients, they have been found to have much severe disease. So what ways can you protect yourself? I think more of the things, and the next thing that we have noticed statistically was people with a vitamin D deficiency have been having a lot severe disease than normal people. And definitely I will give a list of the supplements I would like the people to have and start taking that would help boost the immunity to fight the virus, whether it's Omicron or the fluid. Most of the supplements that I would suggest would be effective for most of the viral infections. One is vitamin C. You can start taking 500 at least twice a day. And then the vitamin D for the adults would be 5,000 daily for at least 2 to 3 months, because most of the people are deficient in vitamin D. And the zinc at 50 milligrams a day. And if people get the cough with the COVID or post-COVID, they can take something called quercetin. Quercetin will help this inflammatory response in the lungs. That would be 500 twice a day for at least 2 to 3 weeks post-COVID. Now, with the COVID, people right now, recently, a lot of people have been positive for a very long time. I have patients who are positive for 3 to 4 months. And do we know what it's going to be, the long-term effect on them? I don't know yet. But we have also seen people who had the COVID had a flare-up of autoimmune conditions like rheumatoid arthritis, lupus, thyroid inflammation. These have been getting worse after they had the COVID. And if anybody has a COVID, just don't take things lightly. Just consult with your physician, have the right treatment option. At least 60% right now with the Omicron are milder cases, but definitely it doesn't harm to get an opinion to see whether you need any treatment now, or maybe you'll end up with complications later, because at this time we are unable to predict the amount of complications we'll have in the long run. I think I pretty much have a gist of what's going on right now. And okay, one more thing is, are we going to have more variants? Possibly yes, because the virus is still evolving and still changing. I think UK just, Boris Johnson's announced no mask policy. I think in the long run, that would probably be something that we need to see epidemiologically. If everybody builds up the herd immunity, that would help everybody boost their immunity to fight the virus as a group. Ramgaru, I can take the questions.
Yeah, thank you, Andy. I think, yeah, we will go with questions that are posted in the chat room. all the attendees, please feel free to raise your hand if you have a question so that you can directly ask the presenter, Dr. Manjula Garu. So we have a question from Venkat Chavakula Garu. If you want, Chavakula Garu, you can go ahead and ask your question directly, or I can read out. Yeah, so he's asking like, can we take COVID-19 booster shot plus flu vaccine together? Is it okay, or any side effects taking together?
I think that's okay to take it both together.
Okay. So that's also from my side. I think no, you mentioned about like no, there is possibility for more variants and all that. So can you give us like no, for a person who is already infected, what precautions he should take so that no, it doesn't spread to others, and also like no, at home not be able to quickly recover from the infection.
See, right now, I think the severity of the Omicron is, for me, it looks like it's lesser than the flu. So what do we do at home is, again, you have to mask yourself. You don't have to quarantine, isolate, but definitely mask and contact precautions with other members of the family is what is recommended. And frequent hand washing. Again, you isolate your clothes or your bed sheets or whatever, and then have to wash them off after the 5 days or the 10 days once you finish your quarantine. And just stay away from little kids and prevent infection to the little kids, because the kids, we are also seeing something called a multi-inflammatory systemic response syndrome. That has been, for a few kids, it has been a little severe, because it's all related to the COVID storm with the inflammatory markers going up suddenly and causing multi-system problems in kids. So definitely watch out for that in your kids. And I would suggest everybody start taking vitamin C or eating oranges every day, and then taking the vitamin D to help boost the immunity.
Yeah, great. Thank you, Andy. So other question is like, right now the schools are all open across US except some exceptions. So school kids are going to school, and they are most exposed to the virus. So what do you suggest for that kind of kids and parents in terms of the extra precautions they should take care to avoid getting infected?
Okay, so the school kids right now, let me tell you the statistics as I know. So if a baby is going to a daycare or a young child is going to a daycare, the kid can have more than 60 episodes of a cold or an upper respiratory infection in 1 year. Do we have similar stats for the COVID? We don't know yet. But again, most of the schools are following the masking precautions and the social distancing and all that. And there are parents concerned, okay, should we keep the kid at home for a long time, just isolate the kid and doing the homeschooling, whatever, or distance learning, online Zoom sessions? I don't think long term that is going to be good for the child, because we see a lot of kids missing on the social interaction with the other kids and getting severely socially isolated and social anxiety happening. So if the schools are open, I would recommend the kids should be allowed to go to the school, because it would also help to boost the natural immunity of the kids. If they're exposed to the infection, they get the natural infection and get the disease and recover. Yes, some parents will have the anxiety, oh my God, what is going to happen? We have any disease, you're exposed, you recover from it. 80 to 90% of the people will naturally recover. Only 5 to 10% will end up in the hospital. Out of that, about 2% end up in the ICU. And if you look at the stats of whether am I going to die from COVID or am I going to die from a cancer or accident, probably the chances of dying from an accident are higher than of dying from a COVID.
Thank you, Manjula Garu. I think we have some attendees wanted to ask you questions. So, Veni Movagaru, can you unmute and ask your question?
Hi, Andy. So I have a preemie baby. She's 8 months old. Is there any precautions I can take, like multivitamins? And also I have elder one, 8 years old. She's going to school. And again, I'm worrying about preemie and elder. What precautions and what kind of multivitamins elder one can take and preemie can take?
How old was the baby when she was born?
She's 8 months old.
No. When she was born.
She born like 6.5 months.
Okay, so yeah, definitely. I think you can talk to your pediatrician and try to give them vitamin D drops.
Okay.
To boost immunity. But if the older child is going to school and coming back, definitely have him shower as soon as he comes back and not getting into contact with the baby right away.
Okay,
so definitely at least the social distancing for the little infant, because she can't get the vaccine yet, she or he can't get the vaccine yet. So that might be something you need to just, anybody who's going out and coming back, just maintain the social precautions to distancing.
Okay.
When you contact the infant.
Okay, for kids, I mean, 8 years old, is there any vitamin doses, like 1 day multivitamin?
Yeah, vitamin D, I would suggest you talk to your physician, but you can probably start off with 1,000 international units of the D3.
Okay, sounds good. Yeah, thank you.
Sure, thank you.
Yeah, Pramila Manigaru, can you? Can you unmute and ask your question, Andy?
Unmute. Hello, I'm Pramila. Namaste ji.
Namaste.
Actually, my question is, so if the patient has a high diabetic and which is untreated, is it possible to put a booster dose? Is it cause any side effects?
I don't think you'll have any side effects from the booster. I mean, you can get slightly sick after you get the booster because just the immune response, 2 to 3 days after you get the vaccine, you might have body aches and a low-grade fever. That's just because the immune response. But that wouldn't have much of an effect, no.
Okay. Another question, if a patient got JJ in the month of May, and what is the possibilities to put a booster? Because he has got a JJ, and now which booster he can take, whether Pfizer or
I
Moderna?
think JJ also has come up that they could get the second booster.
Okay. That's good. Thank you, ma'am.
Yeah, I think Abigaru.
Thank you, Andy. First of all, so let me thank TANA team and Manjula Garg for this session.
Thank you.
I have a question related to the vaccination, especially for the people who came from India. Okay, so I have a friend who has recently come to the US, and he has taken Covaxin, both the doses in India. Can he take the booster dose in US from any of the existing vaccinations?
Yes.
Or will it
I
have?
have a couple of patients who we recommended to get either the Moderna or the Pfizer as a booster.
Is there any recommendation for Covaxin? What is the best suited one?
See, COVAX, they have not released any details on the booster dosing on the COVAX. As of right now, I'm not aware of it. But a lot of people, most of the people that have come from India are either 40 or 50 years old with other comorbid conditions. And I said, I think it's okay to take the Pfizer or the Moderna booster, though we don't have enough data on that.
Okay. Thank you. So that's all the question I have.
Sure.
Thank you.
Thank you.
I think Bindu Garu, go ahead.
Namaste, doctor.
Namaste.
For those who have taken the booster shot, is there any chance of developing complications if they catch the original COVID strain or Delta variant or Omicron?
Okay, let me tell you something. The booster, the vaccines also have side effects. None of these vaccines have been out in the market long enough for us to know the long-term side effects. But one thing I'll tell you, because I had the COVID in the first wave in June of 2020. Okay, and when I had it, it was really severe. For 3 days, I was really sick. I never was sick in my life like that. I couldn't, almost 68 hours in a 72-hour, 3-day week, I was in bed. I wake up and I go crash. I was so sick. So did I have the options for the vaccine at that time? There was no vaccine released at that time yet. And do I know if I get the vaccine now, I will not get the same severity? Possibly, yes. If what we are seeing, you get the vaccine, you can still get the COVID. I'm not saying you will not get the COVID after you get the vaccine. You will still get the COVID. The only reason is that the severity of the disease is going to be lesser. And the COVID vaccine right now, what we have, doesn't cover all the variants. So whatever the variant that was in the past was used to create the vaccine. So does it cover the Delta and the Omicron? I don't think so. So if you had the vaccine, you can still get the Omicron COVID. But the severity is supposedly lesser because you already have some immunity to the vaccine. But the next thing is something called immune evasion, because the new variant and escapes the immune cells from your body from the old variant and still causes the disease in your body. So you will still have possibly have the disease, but not as severe. Does the vaccine have side effects? Yes. There have been reported cases of muscle weakness, something called a Guillain-Barré syndrome, transverse myelitis, and having like chronic inflammatory response and pain for a long term. These are all the side effects of any vaccine that you can, and more so now because the COVID vaccine is being recommended so long. Yes, you will see a little more incidence because a lot more people have received the vaccine. Did I answer your question, Bindu?
Yeah, I think that answers that question, Andy. We'll take another question. I'm also getting directly sent some questions. I think there is a lot of concern for traveling during this time, especially traveling with kids, because kids very young, like under 3 years, they don't keep mask. So what do you suggest for that kind of traveling situation in terms of precautions and anything related?
Okay, travel, one thing I'll suggest, okay, recently, I don't know, December, whatever, holidays, people are traveling, going on cruises, going to Disneyland. There have been some cluster increased cases. So how is that happening? Because people are just gathering too frequently, too closely, and spreading from one person to the other with no awareness of the symptoms that they had it. So wherever you go, if there's more than 10 people, definitely you have to maintain social distance. And the other recommendations I would suggest is if you're traveling on a flight, particularly a long distance flight, if you're wearing an N95 mask, even if you wear an N95 mask, change the mask after 4 to 6 hours. So even if you have the virus, because it's on a flight, you can't predict who's sick, who's next to you. So change the mask, throw away the mask after 4 to 6 hours. So you might have to change it a couple of times in a 20-hour flight.
Okay, got it. Yeah, so another question is what are the symptoms for boosted, those who are already taken booster? Is it going to be mild or they may not even know that they have infected with the virus?
Okay, let me tell you, if I get the booster today and I test myself 3 days later, my COVID test can technically come back positive. So do I have the disease or do I have the booster? I can't tell you. That's how the situation is right now. So the symptom wise, you will have milder symptoms. You'll have mild body aches and a little bit of a headache after a booster dose.
Got it. Yeah. So another question is, again, like, I think the symptoms are very similar between like, cold and COVID. So how to differentiate a cold, a regular cold versus a COVID, and what kind of, I think you already mentioned about
Yeah.
the remedies and the ways to deal with that, but can you elaborate on that?
Yeah, cold and the common flu right now, you will have mild headache. Most common is a running nose, stuffiness of the nose, a headache, sneezing, stuff like that. But with the Omicron, you will have the loss of sense of smell and the taste. With the Omicron also, you'll have a severe sore throat and difficulty swallowing, because that is because the virus stays in the nasopharyngeal passage. Okay, so a lot of people are like, oh, I can't swallow. A lot of people recently, I was like, I can't swallow. And then you look at them, they're like very much inflamed in the inside of the throat. That is not common with the cold. That's more common with the COVID.
Got it. Yeah, I think Tiresh Buddigaru, can you ask your question?
Yeah, thank you, Manjula Garu, for sharing this info. Our
Sure.
kids got COVID like 3 weeks back. So, and they got negative now, but when do you recommend us to take vaccine for them?
Usually you can wait up to 4 weeks after the infection to get the vaccine. So let me tell you, if you have the COVID, technically the immunity from the COVID itself can last you 2 to 3 months. But since there's new variants coming in the virus, you could consider getting the vaccine to cover the other variants that they have not been exposed to.
Thank you, Andy. Yeah, they go to school, so maybe after 4 weeks we can go and take it back.
Yes. Okay, good.
Yeah, next question is actually in terms of quarantining after getting infected, what is the optimal quarantine period? Is there any change between like previous Delta variant and other variants and this Omicron, or how do we measure?
No, right now the CDC only recommending 5 days of quarantine. So after 5 days, you can wear your mask and you can go around. You can return to work after 5 days. Technically, CDC is not recommending retesting at this point. You do not have to have a negative test. You could return to work wearing a mask.
Got it. Thank you.
Okay, one more thing I want to clarify. If people are testing the COVID, if I go for a RT-PCR or an antigen test right now, do I know whether it's Omicron or Delta or any other variant? There's no way of telling on these tests unless this sample has been sent for genome sequencing to a CDC or a reputed lab.
Great. I think Venkata Ravi Macharlagaru, can you unmute and ask your question?
Yeah, thanks, Andy. So,
Thank
Dr.
you.
Mike, my question is basically my kid is like just turned 5 years old. So, how soon you suggest her to get vaccinated, and is it good to travel with a 5-year-old kid?
Yes, it's okay to travel. Listen, how long are we going to be confined? We need to think. And I think statistically, last week, the WHO has released some data saying that possibly we are coming closer to an end of the pandemic. Okay, because look like almost 70% of the world population has been exposed or had gotten the vaccine at this point, and they're saying the incidence, though we see the severity has gone down, though WHO has just released a statement saying possibly we are coming to the end of the pandemic. So I don't know when that would officially happen. But the COVID at this point is like the flu. Are we going to see it again next year, next flu season? Possibly, yes.
Okay. And my initial question was basically my kid just turned 5 years, and how soon you suggest us to get vaccinated?
I mean, you can consider the vaccine if she did not have the COVID. At least get the vaccine, so the severity is lesser.
Okay. So you suggest to get it as soon as possible, right? Even if she just turned 5 years?
You can get it. You don't have to get it like, see, for the kids, people need to understand their immune power is a lot higher than adults. So their ability to fight infections is a lot better than adults because they have a good amount of stem cells which will fight all infections. So do you have to rush and get it like today or yesterday? Possibly no, but definitely would recommend getting it.
Thanks, ma'am. I got your.
Yeah.
Thank you so much, Andy. I think there is another question that is about people who got booster and who regularly works outside home, and then let's say they are infected but they are not having any symptoms and they're asymptomatic. So how do they take care not to spread the virus? Is it possible that the virus spreads from those kind of persons with the booster and but mildly infected, and how they can prevent like spreading from them because they don't know that they are already infected because of the lack of symptoms? So that's the question.
Yeah, that is like a lot of cases have mild symptoms and they don't even know they had the COVID. So they've been going around, they have exposed other people. So if you have any suspicion of having the COVID, you could get tested, quarantine yourself for 5 days. 5 days is day one starts from the day that you had this symptom onset, whether it's a headache, sore throat, lack of sense of smell or taste. So people are not even realizing when they had starting of the symptoms. Okay. So after that, once they have that, and for 5 days, definitely quarantine. And a lot of people after the vaccine, you're still possibly shedding the virus. But again, mass social distancing from other people is what is recommended right now.
Great. Thank you. I think Sridhar Gorantli Garu, can you ask your question?
Thank you, Manjula Garu and TANA team for organizing this wonderful session. So I'm asking on behalf of my friend and friend. So having two questions. Let's say kid got her second dose of vaccine in the morning, but she went to RT-PCR test for her travel purpose and came to know it is positive. So what do you suggest? So that is my first question. And the second question, what do you suggest COVID impacted families due to travel, but who completed their booster shots?
It doesn't matter. You would still technically have to quarantine because now you have a PCR that is positive.
Got you.
That is the current recommendation. Yes. You
Okay.
still need to quarantine for 5 days.
Okay. So how about my...
And do you need a negative test to go on the flight? Technically, no. That is as per the current CDC guidelines.
Thank you, Manjula Garu. And the first question that I put, let's say kid got her second dose of vaccine in the morning, but she went to RT-PCR test for travel purpose and came to know it is positive.
So I think that one she possibly has the COVID because if she just got the test, the vaccine on that day, unlikely that the RT-PCR is positive because of the vaccine. You probably had already had the infection for 2 to 3 days in the incubation period before she turns positive.
Okay, but is it okay, saying she doesn't know, before her RT-PCR?
No, so she still has to quarantine for 5 days. because her test is positive right now. She still has to quarantine.
Okay.
And then do you know whether, okay, let me tell you though, okay, I get the vaccine today. Will my test turn positive today from the vaccine? No. Is the test positive from a different infection? Yes. So I probably got exposed to the infection 3 to 5 days before.
Got it.
Did I answer clearly?
Yes, ma'am. Yeah.
Okay.
Thank you, Manjula Garu.
Thank you.
Thank you, Andy. I think next question comes from Vijay Lakshmi Garu.
Yeah, hi. I have a question. So I got a COVID last year, last December. And after that, after 2 months after that, I am started having a thigh pain. So I want to know, will the COVID will trigger any kind of pain or autoimmune disease? Will it trigger any autoimmune disease?
Yes, we have seen a lot of that. People having a lot of joint symptom, muscle aches, muscle pain. You definitely need to see a physician and have testing done to figure out what exactly is happening.
Okay, will it be done temporary, or will it go away, that muscle pain, or it will be it will be a permanent? That
We can't say right now till we have the lab work and see what exactly it is. But many of them will recover. At least 70% will recover.
okay, but the COVID triggers new autoimmune disease.
Yes, that's what we are seeing.
Okay. Okay, but that autoimmune disease will recover, you mean to say?
No, it all depends on what exactly is happening in the immune response in the body.
Okay. One another question is, like, if we have a booster, so how much will it give a protection against Omicron?
That's what I was saying. If you had 1, 2, or 3 COVID vaccines and you had the booster, is it going to fully protect you from the Omicron? No. So because the vaccine is made from the RNA virus particle simulation, but it doesn't have all the new variants or protection against the new variants. So you can, even if you had like 4 doses of the booster and everything in the past, you can get the Omicron now, you can get another new variant in the future. But the severity will be lesser.
Okay.
Yeah, okay. That's what I want really everybody to understand. Oh, I'm getting the vaccine. Am I going to get the disease? Yes, you can still get the disease.
Okay. Thanks.
Yeah.
Thank you, Pravina Garu, and thank you, Dr. Garu. Yeah, next, I think the question was from Vijay Lakshmi Garu. Pravina Garu, can you go ahead and ask Pravina Mandava?
Thanks, Andy. Thanks, Dr. Garu, TANA. Very informative session. My parents, they are boosted. They are elderly, above 70. So elderly people have extra precautions compared to general population.
The same thing, just supplements Ivandi. And if they have any other comorbid conditions like diabetes or anything, just have them mask when they're going out into groups of meeting other people. And supplements vitamin C, vitamin D, definitely. That I would recommend.
Okay. So even elderly people, this new variant is not affecting as severely as before.
No, not that we're not seeing the severity as much as it was in the first wave.
Okay. Thank you very much.
Thank you.
Yeah, thank you, Pravin Garu. So I think Pramila Mani Garu, do you have another question? If so, please unmute and ask. Okay, while we wait for her to unmute, so maybe I can ask other questions that I came. The next question is about kids, Andy. So should kids wear 2 masks, or a face shield and a mask? And the second part is, do you recommend the masks for under 2-year-old kids?
So right now I can't say much on that. I would just go with the CDC recommendation to mask everybody.
Okay, got it. Thank you. So the next question is, if we have symptoms, but the test comes negative, what to do?
Okay, that is one thing I want to answer. I am seeing at least 1 in 3 people who will have all the symptoms of the COVID, but the test is negative. Okay, so you would have to technically think it is a COVID, but though your test is negative. So on these people, when I retest, the test is positive. So I would just take the same precaution, just quarantine for the 5 days and avoid contact to spread with other people.
Got it. So do they need to test again?
They need to isolate.
Okay. Got it. 1 minute. Got, yeah, some other questions I'm getting. Yeah, someone got severe pains after vaccination, and then so they got scared to take the booster. So any tips for reducing pains and like no, and be ready for taking booster for such kind of people?
I don't understand why people are afraid of pain. You need to understand the booster is trying to stimulate your immunity, and it is going to respond. The response the body gives is some inflammatory response of your joint or in your muscle tissues. You will feel some pain, and any vaccine for that condition, any COVID or flu or any vaccine will give some amount of inflammation in the body causing muscle and joint pain. It's just the way the vaccine acts in the body. So you just would take like Tylenol, not ibuprofen right now. We don't recommend ibuprofen or aspirin post-vaccination with the COVID, but some Tylenol would help. And unless they had severe joint pains and we don't know what it was, you just have some lab work done and figure out exactly what was happening to see if you would have another second booster. But also I did have patients who had allergic reactions to the vaccine. So those would be recommended against not getting another booster.
Okay, thank you, Andy. Pramila Manigaru.
Yes, sir. I'm here. Yeah. Ma'am, if a teen kid has a thyroid problem, nowadays kids has to go to compulsory to school, right? So how can they protect themselves from the COVID, ma'am?
See, that's what I was saying. The kids have a better immunity than an adult. And even if they get, first thing I want to get the fear out of the people of getting the COVID. Okay, in the pandemic, 95% of the people will get the COVID. It's better you get it earlier than later. Okay, so the sense of fear in the mind is gone. Okay, so the best way is boost your immunity. If you get it, you have the natural immunity. If you haven't had it, how long will you stay hiding away from the vaccine? We need to think, how long can you put a kid and confine to the house? I mean, that's not better for the child. So better boost your immunity, get the vaccine or get the disease, whatever, and get the exposure to whichever way to boost your natural immunity.
Yeah.
That would be
13
my
year,
recommendation.
yeah, 13-year kid can get boosted, right? Now.
Yes, he can get the booster, yes.
Yeah, thank you so much. Yeah.
Okay, thank you. So we have Hamsni Garu to ask next question. Can you unmute, Andy?
Yes, it is a wonderful session. I have a question. My parents in India got COVID. My mom got it 4 months back, COVID, and then again she got it in another 4 months just now. My question is, they got a CT scan already, but she has a cough for 2 weeks. Does she need to take another CT scan to see if she has pneumonia, or can she wait for some more time?
It all depends how severe the cough is and how is the oxygen saturation depending on that. And definitely, I mean, she can get a chest X-ray and see, doesn't necessarily need to repeat the CAT scan to exposed to the radiation, but I would just repeat the chest X-ray and do some blood work to see how the markers are.
Okay, so if I think the doctor took just the blood work. If the blood work is correct, then is that okay to wait for some time?
Yes, she can wait. I mean, some people with the post-COVID will have cough. And also a lot of people in the initial wave did develop interstitial lung disease from the inflammation. So I think it's too early to say if she has interstitial lung disease, but they can have developed like chronic bronchitis with a dry cough post-COVID.
Okay. Thank you.
Yeah, so I think we have a general question about the food recommendations for those tested positive, staying at home and quarantining.
They can eat everything.
That's great.
No restriction. And no fresh foods, more oranges to boost the immunity.
Okay, I think a lot of people are looking
They
for
can eat everything.
those that can boost their immunity. I think but you're saying everything is good.
I think they can eat everything.
Okay, thank you. Yeah, so there is a question from someone who got recently COVID positive, but then after that the sugar levels are fluctuating. So the age is around 30. So is it very common, or I think is it something that needs to be addressed?
Okay, I don't know if the person got treated with the steroids. If they got, okay, two things will happen. One thing, the inflammation from COVID itself can fluctuate the sugar. The second thing, if you got treated with the steroids, that can give you high sugars. So both the things can happen.
Yeah, I think the worry is that will they get diabetes because of this COVID if they were not diabetes before?
Okay, that's a very good question you're asking. They'll get diabetes from a sedentary lifestyle more than anything else. So they need to be active.
Okay, maybe,
and cut back on the carbs.
We got it. Thank you. So we have, I think, Saraswati Pupalagaru. Can you ask your question, Andy?
Hello, Andy. Thank you, Manjula Garu. I have a question that the zinc and the quercetin, are we supposed to take continually as a supplement towards, and also the vitamin C and vitamin D and the multivitamins?
I would recommend taking the vitamin C and the vitamin D right now, at least for 3 months. And zinc, if you have the COVID, you can take, and the quercetin is twice a day if you have the cough with the COVID.
Okay, okay. Thank you.
Okay, and we are almost coming to last few questions. Yeah, so when we usually get to know that we are exposed to someone who just tested positive, so is it recommended that we immediately go quarantine, or do we right away test and wait for the results to quarantine, or what do you recommend?
Okay, if it's your close contact in the same household that you've been exposed to and the other person tested positive, you are required to quarantine for 5 days.
5 days.
At least. And after the 3rd day, you can test, because even if you get exposed today, you have an incubation period of 1 to 3 days that you can get the disease. So technically, after the 3rd day, you can get tested. Now, on the 3rd day, you get tested, you're tested positive on the 3rd day. So your 5 days start from the 3rd day.
Got it.
Okay.
So speaking of this testing, right now the federal government is providing home test, self-test kits for all the households. I was reading somewhere that there is a difference between PCR results and the home kit-based results. So if the test is producing negative, but the symptoms are there, so what do you recommend for them? Like if they tested at home using a home kit and result in negative, but they're feeling some symptoms, and what do you suggest?
So I would recommend they go and get a proper PCR test first thing, and then they can still isolate and for 5 days and retest.
Got it. Yeah, I think so. Any more questions from the attendees? I ran out of questions that are sent directly to me. We'll take a couple more questions and then wrap up the session. I think Pramila Garu, do you have a question again? Please feel free to ask.
Yes, sir. Actually, recently we faced like this situation, but exactly the throat get blocked. But when we go and do COVID test, it comes negative only. But the symptoms are with the COVID symptoms. So, in how many days we need to go and take a COVID test? Like if it started on the first day, can we go it on the second day for the test, or we have to wait for the symptoms and we have to go on third day or fourth day?
Ideally, after 3 to 5 days.
3 to 5
because
days.
the incubation period is 1 to 3 days.
Mm-hmm. So in between, can we take some cough syrups, like as you mentioned? So, or if we go for general flu, also we think that it is a flu. We get running nose. Normally, my symptom will be always it will be running nose and sneezing and like a slight headache because of sneezing. So in this case, can we go with the normal like anti like normal medicines? So this makes confusion normally. So whether it is a normal allergy or it is a COVID symptoms, that is what. So it's very hard to find out, ma'am. That's what.
Yeah, it is a little difficult to differentiate whether it's just COVID or the cold or the flu at this time. But if you have the symptoms, I would suggest just isolate for 5 days, and after 3 days you can retest.
Yes. Thank you, ma'am. Thank you so much. Yeah, thank you.
Yeah, thank you, Pramila Garu. I have a last question from my side. If pregnant person gets positive, and is it going to affect the baby? What are the special precautions taken care in that situation?
Okay, like any virus, if it's in the first 12 weeks, if you get the COVID, it can officially definitely affect the baby, but we still do not have enough studies to say what are the long-term effects of the vaccine, of the disease in the baby. So, and then are they recommending the vaccine for the pregnancy? Yes, they're recommending the vaccine for the pregnancy. Okay, I would definitely suggest to consult with the OB to go over that and see.
Thank you. Yeah, consultation with the OBG is the best solution. Yeah, thank you. So Prashanti Garu, please go ahead.
Do we have to change our mask from cloth to filter mask?
Okay, yeah, the cloth masks are not protective at all. So the N95 is the one that is supposed to be protective, and the N95 has to be close fitting, so you don't have open space around the nose. The particles, the virus can spread through that too. Okay, as a regular blue surgical mask versus a cloth mask, any mask is better than no mask, to tell you the truth. So if you can't get the N95s, wear at least a regular cloth mask to prevent.
Okay, thank you. Thank you.
You're welcome.
Thank you so much, Andy. I think we have the chance for last question. Any more attendees having a question that is not yet answered? Please, this is the time. Yeah, we have, I think, Kalluri Sarma Garu. Can you unmute and ask?
Thanks, Andy. Thank you very much for the very informative presentation. One simple question I have is the only strain, is Omicron the only strain that we have today, or is Delta around as well?
I think the Delta is still there, and I think there's another strain that they'll release in the next week.
Thank you, Andy.
Sure.
Yeah, with that, I think we almost finished, I think, close to 1 hour, 20 minutes of the session with no more hands raised. So I would like to go ahead and thank So thank you, Dr. Manjula Garu. It's our privilege to have you and get all the information, latest information on the Omicron, and be able to safely navigate through these difficult times. I would also like to thank the volunteers who helped me from behind in bringing this event happen, especially Dr. Chinni and Deepika. So thank you guys. And I would also like to thank the TANA President Anjay Chaudhary Garu for all the support extended. I would like to thank TANA Past President Jeta Alluri Garu, Secretary Satish Vemuri Garu, Community Service Coordinator Raja Kasugutti Garu. And also I would like to thank the entire TANA leadership, especially those who attended this event, Dr. Umakari Garu, Venkat Misala, Vamsi Vas Reddy, and entire TANA committees and RVPs. Without their help, we would not spread the word across the US. So thank you again. Thank you all the attendees, the most important guys. Hopefully this session gave you some important information that you are looking for. And with that, we'll be taking care to handle COVID in a better and safe way. Thank you again. And I think with that, we conclude this session. I think, is there any person having any more question? I saw one more hand raised.